Dr. Jared Brush, welcome to the Valder Beebe Show live out of Dallas, Texas. How are you today?
I'm doing well, thank you. It's great to be here.
It's great to have you here. Okay. Dr. Brush, you're here to talk about Alzheimer's. That is such a big topic with my show. Could you tell me what Alzheimer's is?
Yeah, it's a great question. And I think as a neurologist that specializes in seeing individuals with dementia, and in collaboration with Eli Lilly and Company, we're really trying to raise awareness about this exact topic. What is Alzheimer's? How do we detect it early? And I think the core of your question really comes down to the fact that Alzheimer's disease is a buildup of plaques in the brain. We call them amyloid plaques, and those plaques develop over the course of 20 years before a person ever has their first memory symptom. So it's sort of on this spectrum. And our goal is to try to detect people in those independent stages when they're just starting to have memory problems. We call mild cognitive impairment. So if we can detect Alzheimer's at that point, that gives us tremendous opportunities to try to help an individual remain independent and also to consider treatment opportunities. In fact, we now have treatments that can remove the plaques that cause the disease.
Oh, how exciting. Give me a couple of examples, maybe what you're looking for to try to determine if a person has Alzheimer's.
Yeah, the symptoms that I'm looking for can sometimes be confusing and confused with the normal aging process. And I often joke around, that I walk into a room and I don't know why I showed up there sometimes. And I think that's an occurrence that happens to a lot of us, or being able to come up with that person's name or maybe our favorite restaurant's name or something like that. But what I'm looking for when I'm interviewing patients goes beyond that. I'm looking for and listening for a person who might forget a conversation that even occurred with a loved one, or they might repeat themselves, or they might repeat a question because they can't remember what the answer is. They might struggle a bit more with their calendar and being able to remember an appointment time or a date. Someone might also have more difficulty with navigating or coming up with the words in a sentence consistently. So when I hear things like that, I start to think this may be going beyond the normal aging process. And that's the point when a person really needs to reach out to their providers.
Do you have specific Alzheimer's testing, or is that done at your general practitioner's yearly visit?
Yeah, it's a great question. I think there's no reason to wait to an annual visit if a person is experiencing these types of symptoms. And I always encourage a family member, be it a brother, a sister, a child, if they notice those symptoms, it's always helpful to accompany the person who's having those symptoms to a primary care provider's appointment. And that's where everybody ought to start. There are new tools that are empowering primary care providers to make these diagnoses. And so they'll always start off with some form of a cognitive test to try to determine, is this a real memory symptom I can detect? They might consider additional blood work and brain scans, but they now have some new breakthroughs, a new blood test that can be used in the primary care office to detect the proteins and those amyloid plaques that we were talking about. So we can make a really rapid Alzheimer's diagnosis and say, this is the cause for your symptoms.
Once just say you do this test in your primary care doctor's office, once it's determined that you may be susceptible to this disease, what do? Do you go off to a specialist, or what happens next?
Yeah, it's a great question. And really it's based on a given individual. There are so many different factors there. When I talk to a patient, the first and foremost thing in sort of setting the stage is I want a person to remain independent as long as possible. And that's absolutely key. And so putting safeguards into place to help them with medication compliance and helping them not be scammed by people who are out there trying to get a hold of their hard-earned money. Teaching them about lifestyle factors that might help slow the progression of the disease. Those are really important things that, and a conversation that they can have with any of their providers. Beyond that, though, there are specialized treatments that can be prescribed now that may have the opportunity, if we can detect Alzheimer's disease in those earliest stages, to potentially remove the plaques and slow progression.
how do you get into a treatment plan? I'm sure it's a recommendation that has come from your primary doctor, the way the American medical system is structured. But how do you get to that test for Alzheimer's, that they're doing this trial, or how do you get the latest medication? What's the next step for people?
Yeah, exactly. Great question. And, I think we're trying to empower primary care providers as much as possible to be able to make a diagnosis. And that's where these new blood-based biomarker tests really come into play. Once that diagnosis is established, getting to the core of your question, there's a variety of different pathways a person can take. In my system, we have some direct routes that go to these new treatment programs. There's also routes that can take them to neurologists that are familiar with clinical trials. So each system is a little bit different, and I think an individual can help decide what's important to them and how much further do they want to go.
Online, is there a place for people, caregivers, people listening to this who say, I might fit that category? Is there a place for them to get more information?
Yes, absolutely. My first recommendation is always that they regroup with their primary care provider, and they can start to discuss whether these symptoms go beyond the normal aging process. But online, there's a variety of resources. One really important resource is morethannormalaging.com.
Dr. I want to thank you so very much for talking about something that people are talking about at their dinner tables. This is a real situation in the lives of Americans. So thanks for stopping by the Valder Beebe Show. I really appreciate it.
Thank you. It's been my pleasure.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.